Hello everyone. In this video, I'm going to share with you a very important 30-second exam that can be utilized by the physiotherapist to assess patients who come to physiotherapy OPD with complaints of low back pain. The two most common causes for low back pain can be that of arising from the articular problem, that is the joints present within the two vertebrae, and the disc issues. The exam will help us determine quickly whether the source lies within the disc or the joints. So to perform the 30-second exam, just make the patient go into the prone lying position and just quickly palpate both the sides of the spine with the same pressure and look for the presence of tenderness. Now, whichever side will feel more tender as compared to the other is the side that we are going to look for whether the source lies within the joint or the disc. So the examination has to be done with the therapist's hand forming a cup so that the thenar and the hypothenar eminences are lying close to one another. And the pit so formed by the heel of the hand has to be placed over the spinous process, and we can start this exam right from the L5 vertebral level. Now what we need to do is that we need to place both the thenar and hypothenar eminences over the transverse processes on each side, and while keeping the elbow straight, we are just going to spring the different levels of the spine from the lumbar to the thoracic region. And what we are going to look for is the quality of springiness and the aggravation of pain. Now there are two scenarios that can happen while doing this screening. At any particular level, if we find that the joint is springy but is painful, then the source of pain lies within the disc. Whereas on the other hand, if the joint feels stiff, that is less springy and painful, then that means that the source of pain is lying within the dysfunction of the joint, that is the zygoepiphyseal joint. So this is how we can quickly determine that the source is joint or disc and can take decisions accordingly. So let me just quickly demonstrate how I perform this exam in my clinical OPD for the lumbar spine as well as the lower thoracic spine. So with the patient lying prone, I quickly screen for the presence of tenderness at different levels of the zygoepiphyseal joints, and once I find the tenderness, I just simply then mark that area and start my examination from the lower lumbar spine and start springing the different levels, and I look for the quality of springiness and aggravation of the pain symptoms. And this hardly takes me around 30 seconds to screen the whole of the lumbar spine as well as the lower thoracic spine. So this was all about the 30-second lumbar and thoracic spine springing test that I wanted to share with you all. Keep learning, keep sharing, and stay connected.